At this time, we'll call our meeting of the Royal Oak, 14 years of running meetings in Royal Oak, that's what happens. So, the Oakland Community Health Network Board of Directors meeting. At this time, please rise if you can for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. At this time, Shirley, would you do the roll call of the members?
Yep. Mr. Landsman?
Here.
Mr. Young?
Here.
Mr. Furman provided notice that he would not be able to attend today.
Right.
Dr. Giles?
Here.
Pastor Jones?
Here.
Ms. Woodruff?
Here.
Dr. Hans also provided notice. Ms. Newman?
Present.
Ms. Root? Here. Ms. May? Mr. Torres? I thought I seen him.
He is here.
Okay. And Mr. Cowan?
Present.
You have quorum.
Thank you. At this time, I'll entertain a motion for the approval of our board meeting agenda. So moved. Second. A motion and support. All those in favor say aye. 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 All those opposed? The motion carries and our agenda is established. At this time, we have an opportunity for public comment. We would ask you please state your name when you come up, and also please limit your comments to 3 minutes. There's two of you want to speak? Okay, well, you can fight over who's first. You can arm wrestle. No. There we go.
Good evening. I'm
Good
Fred
evening.
Cummins, President of Alliance for the Mentally Ill of Oakland County. And this is my wife, Hope Cummins, and we share a daughter who is mentally ill. Hope is going to talk first.
Okay, go right ahead. If you could pull the microphone in front of you. Thank you. Yeah, then everyone will hear you, just not me.
Okay. Well, I'm not sure you want to right now.
Okay.
I'm Hope Cummins. I had a daughter who was mentally ill, was a community mental health client for 20 years. Our daughter died January 21st, 2019, as a terrible, grievous head injury that she got in 2013 because of the care she got. It's not an opinion. It's a judgment of a court. But Paige was terribly ill, and after she was injured, she needed two-person assist. We had 2 lifts for her. She had a feeding tube and all the supplies with that. She got diabetes insipidus because of the head injury. She was in a hospital for a week and a day after she got hurt. She went from intensive care to an LTAC, which probably nobody's ever heard of, long-term acute care hospital, to an inpatient rehab because she still had a bone flap and no skilled nursing would take her when she still had a bone flap. And then she went to a nursing home and she went to our house. And she couldn't walk. At the time she left rehab, she could walk. And she actually had lost her feeding tube, but within a couple days or a couple weeks of care, she was back in the hospital. We took care of her. CMH refused to take care of her. They said she was too sick and she was no longer a CMH client. So we had years of taking care of her. And when she died, I couldn't leave. We'd spent all that time with her, and I just couldn't leave her condo at that time. So, but now we're ready. I mean, we've got to sell her house and go back to our own house. And so recently I decided I was going to come back to CMH. I used to be very active, and so I searched the web page to see who the board members were, because I haven't been for a very long time, and there's a lot of faces I don't know here. And I was very surprised by what I found. First, I looked at the board membership, and I found a list of CMH board members. 5 of the 12 are on the web page as having a term limit through March of 2023, which is almost a year expired. Our web page defines 5 of you people as term gone. Those people are Jonathan Lansman, Sarah May, Christina Rutt. I don't know a lot of you people, but I'm just telling you this because Yvette Woodruff and John Young. All of those people identify you on the web page as having no term anymore, that your term is over. You have 5 people on the web page who have good terms, various and staggered terms. Dennis Cohen, Malkaya, Adam Furman, Dr. Hans, and John Paul Torres. And then there are 2 people on the web page, which is Pastor Jones finally got a bio after I don't know how long. He was on the web page as unidentified. He's just a name. And he recently got a bio, but he has no term at all on the web page. It's missing.
Mrs. Cummings, your time is kind of
Well, let
gone
me
over.
finish this part.
Well, why
Now
don't you
I'll
finish it? Fine, that's fine.
Okay.
I'm just, if you could come to a conclusion.
I
of
will,
what you want.
but this is important, and I haven't been here for 10 years, so I think you could listen, because this is important, because
I'm
this is how
listening.
you're doing business here.
I'm listening.
And Yolanda Gibbs, I understand, is maybe a doctor. I don't think she's identified on the webpage at all, and she doesn't have a bio, and she doesn't have a term limit at all, so you don't know where she came from. Or, and he can...
Thank you.
That was my turn.
Yeah, sure.
Well, I was supposed to finish, but I couldn't, so...
So we're rather disappointed in the accuracy of the webpage.
Yeah.
And beyond that, we had some confusion about when this meeting was, because you look on you find the calendar, after you find the calendar, because you have to look for the calendar. It's supposed to be a public meeting, but it's kind of buried. You find it, and actually there's a calendar, and it's got dots on it where the meetings are. There's no dot for this meeting for today. On the side, which you don't see if you're looking at a cell phone, is where it says it's actually today. Okay. So that's really rather disturbing. But just the fact that you have to search for this calendar. There should be a calendar that clearly defines all public meetings that you're responsible for. So that anybody who's interested in attending a meeting can go to that calendar directly and see when the meetings are, and some statement about what they're about, because you've got meetings on this calendar which is a name. Nobody knows what they're about, why they're there, if they're public. So, concern about compliance with the Open Meetings Act. What's public, what isn't? How do you know that when it is? So, effectively, there's more comments that I have at some point later in a later meeting regarding the web page, but it really is not a good representation of this organization to the public, the people you're serving. It needs to be accurate and easy to use and clearly reflect what to expect from this organization and how to get it and how you really expect to help people. And it's kind of like, yeah. So the webpage, the completeness and accuracy of the webpage, I think, reflects a lack of accountability, both of whoever's doing the webpage and who's overseeing it, because this existed this way for a while, and that's a problem. But again, that reflects on the organization and what the rest of the community thinks of it. Oh, I'll throw in the other comment. One of the things in the webpage is some mention about the organization and the top management of the organization, which are described as the leaders of the organization. If you look at the definition of leadership, these are not leaders. These are employees who are managers. Leaders are people who are making the rules, providing the direction, the strategic direction of the organization. That's you. And you are not identified as the leaders of the organization. In fact, there's no indication of what your role is at all, except you're members of the board. And the other members, the employees, are listed as the leadership, which is inappropriate also.
Okay.
Thank you.
All right. Thank you very much for your comments.
You want to pass that out just in case?
Can I pass this out? You can go ahead.
Sure.
It's obituary for our daughter when she died, so
Right.
she's a real person.
Okay. Thank you.
She was a real person.
Is there anyone else who wishes to address the board who's here in the meeting room? We'll pass it around. That's fine. Yeah, we'll take it. Yeah. Okay. Yeah. Is there anyone online?
If you are online and wish to speak to public comment, please raise your hand at this time.
Okay, thank you. There being no one else, we'll close the public comment. There is an opportunity for public comment also at the end of the meeting. At this time, it's our pleasure as a board to recognize an employee with 45 years of service. So Vicki, I'm going to let you, I won't steal your thunder. How's that?
Awesome.
Go right ahead.
This is a monumental moment, I think. So Nancy Upler has been with our organization for 45 years. She's currently a support specialist in the due process team. But Nancy's been with our organization and with a number of teams for many years, including she worked for the recipient rights team for many, many years. I just want to confirm, Nancy, are you with us online?
Yes, I am.
Great. So I have this really awesome statue for you. It's just beautiful. We'll be sure that you get that. And Nancy could not join us in person today, but we're certainly glad she could join us online so that we can celebrate all of those 45 years. So I was thinking about 45 years, that's a long time. Now, I want to say that I've not lived for 45 years, but that would not be true. And I've worked here for a long time too, so I've known Nancy for a really, really long time. But I was thinking about how incredible it is to work in an organization for 45 years. So think about how much change that Nancy's experienced in the public mental health system in those 45 years. A tremendous amount of change. Many services were provided by the state at some point, and then they went to, I forgot what, managed something or other before managed care. And then we had managed care and PIHP, so many, many changes. How many CEOs has she worked here through? I don't know, Nancy, if you ever count those up, but I'm sure it's been many. How many bosses has she had in those 45 years, right? Thinking about all that. And also all the name changes of our organization over the years. So it's just quite incredible. So I have known Nancy. Nancy is a hard worker. She's dependable. She gets the job done. She doesn't quit until she gets the job done. I've always appreciated the skills that she's brought to our organization. I know if Nancy gets assigned to something, she's going to get it done. She's going to look to see if there's some way I can make it even better, and I appreciate that. So I can't even express to you how much I appreciate that Nancy has spent 45 years of her life dedicated to this organization, to our mission, to the people that we serve. That's just incredible, and I think we should give her a huge round of applause. Nancy, any comments from you?
Sorry, I have COVID actually right now, so I sound kind of harsh. Anyways, I want to say
Appreciate you
thank
being
you.
with us anyway.
I'm getting through it, so that's good. Yes, I do want to say thank you, Vicki and Benita, and everyone else I've worked with over the years. I can't believe it's been 45 years. I've worked with so many wonderful people and have made some lifelong friends. And I just want to say I appreciate everyone and working at this organization. Again, thank you, everyone.
Thank you, Nancy.
Well, thank you. A humble servant to so many people over 45 years, and I think you measure the impact someone has, not just in the number of hours, but in the service she's provided and the lives she's impacted. And I think that's the thing that is most stunning about what she's done. And we've heard so many good things about her. And I mean, she was here before this organization was really formed in its current format.
Yeah,
And
still back with the county.
She's the institutional memory, I guess, of the organization to a large degree. So
Yeah.
we're very pleased, and we appreciate the fact, Nancy, that you could join us at least virtually tonight, and we ask you to continue your good work for as long as you choose.
Thank you.
Thank you. The next item on our agenda is our one of our favorites, Stories That Inspire Hope. Trish, if you want to come up this evening and with your guests.
All right, good evening. I am here as part of the Stories That Inspire Hope to introduce you to our CIT Officer of the Year, Officer Chris Solomano from Bloomfield Township Police Department. Joining him is Sergeant April Swatala from Bloomfield Township, and also one of our co-responders from OCHN, Courtney Thomason. So Officer Solomano received this award last month at our Law Enforcement Appreciation, and I'm going to read a little bit about what the award was that he read, and then I'm going to turn it over to him to begin his spiel that he has. So this award is for an officer who demonstrates continuous use of exemplary CIT knowledge and skills. Some examples of this may include successful use of de-escalation skills, knowledge, and referrals to community resources, regularly volunteering for CIT calls, regular and continuous contact with the mental health community, follow-up after CIT calls, and or showing compassion towards people with mental illness, lived experience, and their families. Their work highlights outstanding dedication to the CIT program, CIT services, and advancing CIT as a successful community program. This person demonstrates their expertise in working with diverse populations through engagement, problem solving, and community interventions. Officer Solomano was nominated by two different individuals, and here's a little bit about what they had to say about him. Officer Solomano is a CIT road officer and peer support coordinator at Bloomfield Township Police Department. He is unwaveringly positive, professional, and invested in the community he serves. Chris treats everyone he meets with respect, dignity, and feeling like they matter. No matter what the situation is, Chris is always an asset on scene, especially with those struggling with mental health issues. Officer Solomano actively listens patiently to individuals on scene, makes time to engage with them, and helps them find the most effective solution. He has a very calm demeanor and is often able to de-escalate an individual to work through the issue together. Chris is a team player, not only working with other officers on the scene, but also with co-responders, family members, etc. I know when Officer Solomano is on a scene, we will have a positive outcome. Officer Solomano volunteers for most of the crisis calls at our agency. He takes the time to meet people at their place of need. He slows situations down by utilizing de-escalation techniques. He shows great patience and respect to everyone he contacts and works very hard to get them the help they need by providing them with the resources. Chris takes the time and shows great caring in referring individuals to those resources. He goes out of his way to ensure everyone is safe and satisfied with service. So, Officer Solomano.
Well, first, thank you very much for having me here. Again, my name is Chris. I really can't sit here and take all the credit because without, especially Trish and my sergeant, Sergeant Sutala, with Courtney and Hillary's help, I definitely would not be here today, be able to speak with you guys. Our department has really made it an emphasis that starts from our chief on down, starts with April, to focus on crisis intervention, and I have seen all the positive benefits that has really benefited our community and inside our department. And it's invaluable training that we get, and it really is useful. I also definitely want to highlight everybody here at OCHN, the CIT program, our co-responders. They definitely do a lot of the legwork and hard work behind the scenes that truly get the results that the community is looking for. And it's something that officers have needed in their toolbox for a long time, and it's very reassuring and very great to see that we now have those tools, because without them, we were lacking in years past to truly help our community. These effects also have a wider spread and we don't always see the effects. And I just wanted to highlight a couple of the things that, go unseen. The big thing I have found in my 12 years is that trust is usually the most important aspect of policing and within the community. So having OCHN as a tool helps build that trust with somebody who I'm out on the road talking to. And without you guys, that foundation cannot be laid. And people think that when we show up, it's just going to be rinse and repeat of the same thing. They're not actually going to get tangible solutions. But now with CIT training, with the backing of OCHN, I can actually give that tangible solution. And I don't always see the end results, but I know that Courtney and Hillary, our co-responders, are doing the hard work behind the scenes, because a lot of times I will ask and follow up and be like, hey, how's this person doing, or how's this person doing? And I hear a lot of positive results that people are finally getting those resources. I know I don't have to preach here about how useful CIT is. The one other thing that I have really seen that I didn't even fathom at first is the mental health of officers. I have been able to use these resources given to me in my personal life, with my family, and I know that having those aspects of my life better at home, and I can bring that to work, and I can do a better job for the community. Like Trish was saying, I'm part of the peer support team, and I see that officers who have embraced CIT now can go out and actually do what they all intend to do and what we all intend to do, and that's really just to help people. Other than that, I do really appreciate you guys letting me speak. I'm more than happy to answer any questions, bring up examples, but I know that I wouldn't be here, like I said, without your guys' help, without Trish, especially without Hillary and Courtney and April here. So thank you.
Thank you. Do any of our other guests want to speak?
You guys have anything you
Please
want to
feel
say,
free.
or we can open it up to questions?
I'd like to speak for a minute.
Sure.
Thank you. April Swatala with Bloomfield Township. I'm a sergeant there, been there for 25 years. And, as Chris alluded to, when he was speaking, when I started, there was nothing. There was nothing for officers to be able to reach out and help the community in any way other than jail and possibly we'll commit that person. So one of the things I have in my trainings, so I'm now one of the CIT instructors, and part of that facilitation group for Oakland County, teach all the officers de-escalation skills, resources, and it's nice to now come full circle. At the beginning of the class, I have a clip from probably 20 years ago of a woman in crisis. And it is not a video, because we didn't have that back then, but it's an audio clip. And she's screaming. Every time that I try to talk, she's screaming. And I had no skills, no training to be able to even know how to begin to address that. And even in one of the parts of it, you can hear me laugh, because I was just completely overwhelmed in how to help this woman. And so from that point now, you know, making it kind of my mission at work to be able to get the people the help they need to make, and now having OCHN come on, you know, and making these connections in the community. And I'm now able to teach officers how to help someone when they are in crisis and how to reach them when they're at the point of screaming and don't know what else to do. So it's just really wonderful to see everything that's happening within the county, and more so for the people that we serve, because that's what it has always been about. We deal with, you know, maybe 2% of the people that we encounter are bad guys, right? People that really need to go to jail. Everybody else is in crisis. Everybody else has something going on in their lives, and now to be able to see all the resources that the county brings in is really just a wonderful change. So thank you.
Thank you, Sergeant.
And Courtney is our newest co-responder, joining us almost a year ago, and she serves with Hillary for Auburn Hills, Bloomfield, Birmingham, and Rochester. So if you want to say something about a little bit about what you do and
like Tricia said, my name is Courtney Thomas, and I work for 4 different departments. Obviously, I work for OCHN, and I absolutely love it here. When I took this job, I wasn't exactly sure what I was getting myself into. And when I got here, the other 3 that worked here, they said, we're still building this and figuring out too, which was super comforting for me, because this is new. Hillary was the first one, obviously. Does everybody know Hillary? She's great. If you don't, you should know Hillary. But I appreciate how welcoming all the departments have been into having us, like, not just Chris, but I'm going to point him out. When Chris is on a scene, I know that I have a role, and he's going to allow me to do what can be helpful and what can make these situations better, and I know I can depend on him to make sure I'm safe, as well as himself using his own skills. I was just telling him that my first call in Bloomfield Township was with him. I walked up, and he said, this is where you can help, and this is where I can help, and everything went as smooth as you could see it happen. So I don't know what. I don't know.
You've been perfect. Thank you. Thank you. I'll open it up and invite any other board members, but as I've stated before, coming from a family of 3 police officers over a couple generations, I understand a lot of the challenges and the impact it has at home, in particular when you talk about mental health. You know, my family members went through a time when there was no assistance for these types of issues. So it means a lot to me personally, not just in this position, to see the impact that the program's having. And at the end of the day, you're saving lives. And we applaud all of you for that. And we're very pleased that you're participants and full participants, because I know I've said often that police officers are the ultimate skeptics. And they're trained to be that way, because they have to find out the truth of what happened in any situation and then respond to it appropriately. So, you know, what you're doing is you've overcome the skepticism with this program and see the value that you bring to it, as well as people like Courtney, and we're glad you're on the ground floor. So, again, I want to thank you and applaud you for all your efforts and what you do day to day in helping the community. Anyone else? Pastor Jones?
Thank you, Mr. Chairman, and let me compliment each one of you. The effort that goes along with the co-respondents, I tell you, I champion a lot of projects, get engaged in a lot of projects, but the co-responder program has just really been one of the greatest things ever. And I thank you all for what you do. As we continue to work at it, I understand, I think, and probably not as much as I should, the struggles that you have to go through, what you had to deal with as police officers, without the help of the co-responders. So I am excited about it. You know, I talked to a lot of people about what you all do and the value of the program and the number of people that you have helped and continue to help. So I just want to give accolades to you all for what you do, for the service that you give, the patience that has been gained, you know, in relation to having a co-responder there to deal with a person who is struggling from some mental capacity, all right? So really thank you very much. And with that, I really feel I want to thank Trish for what you do. I know I've given you all kinds of hard times in talking, but I tell you what, the effort that you put forward is just excellent. And the team, Christina, where is she? Is she here? Bert, there she is. Okay, her and Suzanne Wentworth and Caitlin, right? Who has just really worked with us in our subgroup to promote, to gain the support of other agencies to make this a reality. So I tell you what, I can't say enough about how much I appreciate the effort. I appreciate you guys that come on board with your clinical and clinician type of abilities to help. But congratulations for what it is. And I tell you what, I know you guys as officers, guys and girls, sleep a little bit better when you know you have a person like your co-responder there with you. Thank you.
Thank you, Pastor Jones. Is there anyone else? Yes, Mr. Shores?
Yeah, I just want to thank you all for, I love hearing about this program and what happens, and congratulations to you, officer. It really excites me when I see the approach that policing is going these past, I'd say, decade. I worked where I worked for several years as a probation officer, then on the administrative end. But just seeing, what happens in our communities and what you all go through as police officers in today's day and age, with so much scrutinization and those kinds of things. But you said something really interesting, which I think really gets to the heart of people that enter law enforcement and police officers, is that you want to help people, right? That's why you're there. And what can you do to help people? How can you sift through all the other stuff to get to help people? And it's so reassuring to see. And just secondly, the idea of making sure that you do take care of yourself, right? Because of the things that you guys see and you deal with, and in as far as our OCHN employees as well. But you are doing great work to help people, and I think that's what public service is about. So thank you.
Yes, Malkia?
I just want to commend you also for the work that you do. I feel very special to be one of the trainers. I come with the family groups and talk to the officers, and they've been very receptive to my story. I believe I first heard about CIT in 2007 or 2008 at a NAMI conference, and I knew that it would make all the difference in the world if the officers had a chance to be trained to know how to respond to people in crisis. So when it finally got here, I was ecstatic because I knew it was going to do what it's doing today. So thank you for your dedication and your hard work.
Anyone else? Yes, Jonathan?
So I would like to take a moment and thank you guys as well for all your efforts being out on the street. They always talk about law and order, and the law side is maybe at most 10%. It's really what goes on in life. It's the 90% out there. And the crisis intervention program in your efforts really is to find a way to help place order, de-escalate, to take chaos and turn it into something that's quieter, less shrill, more beneficial, so that folks can breathe. Because half the time they can't even breathe because they're just the intensity is there. So I just want to thank you guys for the efforts, for trying, and then sticking with the technology or the the techniques to bring this on, because it's not easy to learn something that's so very different, and then apply it, and learn how to apply pieces of it, not just the whole thing, not always the hammer, but, knowing that it's a screwdriver sometimes, that it's something simple that's out of the training. It's a piece of the toolkit, as you said earlier, officer. So I just want to take a moment and thank you guys for all that, and be able to look across the whole thing and say, size it up, let's see what we can do. And then I know 9 times out of 10 you still have to shift gears, because it's not exactly what you thought it was, and that takes mentoring skills, seasoning, and so very appreciative to all 4 of you and the others that are out in the streets tonight. So thank you.
Thank you very much for coming, and continued success in all the good work that you do. Thank you. All right, we'll continue with our regular agenda, and the first item is some reports from our chairs, including myself, and I'll lead off, and this is a perfect segue. The only thing I want to note this evening is the CHMA conference that was held in Kalamazoo that several of us attended, and the highlight for us was the presentation by our team to the conference, and it was very well attended, the section that they did on the CIT program. And it was, we had a number of people there who were in process of putting together a team or a program for the first time, and they found the things that were shared very, very helpful. I know, Dana, you'll probably mention a little bit more, and all the individuals who participated, but it was very humbling for us to see the great work that has been done by this organization, along with all of our partners, and to be able to share that with a statewide audience, and encourage them to come up with similar programs, those who haven't, as well as assist those who are in the process of putting programs together. So it was a great conference to attend for that purpose alone. But there was more that we learned. Unfortunately, no word yet from the state on anything with redetermination of any rates. We know with the redetermination of Medicaid, that is going down. So we still are in a holding pattern in terms of some of the aspects of our financial future. We got the most up-to-date information, and there was no change in status. So I'll leave it at that. At this time, I'll pass it over to Yvette Woodruff for Policy Management Committee Chair report.
Thank you, Mr. Collins. Under Policy Management, there were 4 items for review at the Committee of the Whole meeting. One of the items was for review and file only, which was funding year 23, end of the year quality assessment performance improvement plan. The first item that needed board approval was presented by Ms. Marquita Massey, the Director of Quality Management, which was the Quality Assessment Performance Improvement Plan and Quality Improvement Program Description for fiscal funding year 2024. After discussion, the Policy Committee unanimously made the recommendation to send it to the full board for final review and approval. The second item for approval was presented by Ms. Vicki Suter, the Director of Recipient Rights. She submitted an appointment recommendation for Renee Netto to be appointed to the Recipient Rights Advisory Committee. The Policy Committee unanimously made the recommendation to send the application to the full board for final review and approval. The third item for approval was presented by Ms. Frances Carley, the Director of Strategic Initiatives, and Ms. Christine Burke, Chief of Staff, the Needs Assessment Survey. After a brief discussion, the Policy Committee unanimously made the recommendation to send the survey to the full board for final review and approval. That concludes the items that were discussed under Policy Management at the Committee of the Whole meeting on February 12th. Respectfully, Yvette Woodruff.
Thank you very much for that report. And then our Finance Committee Chair report, Jonathan Langsman.
Thank you. We had 3 financial topics at this last COW meeting. The financials were presented by our CFO, Cheryl Johnson, and her CFO, Deputy Patrick Franklin. And looking at the graphs for revenues and eligibles, the numbers are dropping. So the number of persons we served has been pretty stable, but income itself, money that funds everything, is dropping. The trend indicates this has and it will continue to impact us, and it will impact our Medicaid funding for the programs for the rest of this fiscal year. There was a request to show data values for our dollars and revenue on the graphs for both revenue and for eligibles. So hopefully that will get updated in the next coming weeks. And lastly, finance is still working on revisions to our budget. It's not a trivial effort. They've been working on this for the last few weeks, now over a month now, and it's not easy. In a normal year, they take 2-3 months to build up a budget for the upcoming year. So to take a long, clean, hard look and do that very quickly is not easy. It is very challenging. We also had 2 contract requests, contract extensions. One was for medical controls maintenance, the MCMI contract, that our COO presented on it, and that's to replace the HVAC roof dampers. So that's what makes this, that's why the building stays cold or stays too warm, because they don't open and close fast enough and smooth enough. So it does make it interesting around here. So that was both funded in the budget, but also it's going to get covered by a reimbursement grant to cover the whole cost. So the Finance Committee voted to recommend approving this funding request. And the second one was for the American Guard Services. And it's a contract extension for unarmed security services, and it's to expand the coverage from 8 to 24 hours a day, 7 days a week at our crisis center, covering the Youth and Family Connection area at the RCC or in the complex. So this contract is going to end on December 31st, 2024, and they're running an RFP process right now to begin in June to rebid the overall security for that building and perhaps this building as well. And again, the Finance Committee voted to recommend approving this funding request when it comes up on the agenda tonight. And that's my report.
Thank you very much. Any questions from board members on either one of those reports? Thank you. First item of contractual business will be the SUD advertising contract. If Suzanne Weinert is listed as the presenter, but we have Christine also. Thank you. So if you can come up and talk about this. I don't think this was on the cow agenda, right? So.
No, it was not. And before Suzanne goes over the contracts, I do want to apologize to the board. We were working in good faith and due diligence that we were doing this correctly, and that we were a month ahead of schedule. When we bring our advertising contracts to the board, we take into consideration a historical factor that our teams receive various grants throughout the year that are very specific for outreach. Sometimes they're planned, sometimes they're not, and then we jump in to help them coordinate whatever the initiative is. In this instance, the monies that are coming from substance use, it's the CSUGs, so it's the COVID Substance Use and Gambling Services. The dollars were already included in the Oversight Policy Board budget and approved. The contract itself, the funds have to be in place by March, but we can use them throughout the year. And when we started to put the contracts together, they were all under $100,000. And shortly after the cow, when we sat down, what we realized is each contract pushed the contracts that were approved by this board over the not-to-exceed amount. And so we called Kalana right away and said, we know everything was approved, but transparency is important. And Kalana recommended that we bring it to the board. We asked Sheila if we could talk about it tonight, and if Suzanne could present the information to you. The funds, because of COVID, will not be provided to us again. It is a very unique opportunity, and it is for awareness only. So we worked with our substance use team to develop it. And again, when we realized we were under $100,000, but these NTEs everywhere, we wanted to make sure that the board was aware of the grant and aware of how it was going to be used. I hope that helps.
Okay. well, I'll open it up for questions since, or Suzanne, did you have anything you wanted to add?
Christine summed it up very well. You have it in front of you, the contract, and actually, it's a couple of the vendors that do not exceed amount, but we wanted to be transparent and provide the whole campaign. These are all of the options that we're going to use and all of the vendors that we're going to use. You can see radio, billboard, bus ad, cable, and as well as television. So it's a comprehensive campaign, and we're looking forward to getting an awareness message out there for our substance use disorder services.
Okay. Does anyone have any questions? Mr. Young?
Yeah, thanks for clarifying why it didn't come. This was kind of a surprise to see it. So I guess walk me through it. It says multiple agencies. So are we buying this? Is an agency placing it? How?
We are working with the individual agencies to do the advertising campaign. They provided contracts for us, and we're working with them. They are helping to create the ads and the creative for us.
So it's part of, I understand what you're saying. So when we're saying agencies, we're actually talking about the medium. So if we have a contract with, say, Channel 7, part of that contract, which is our standard, their creative team helps us produce the materials.
Okay, so this is direct to these media companies. There's no agency,
No,
so there's no
no.
commission. So
No.
these are the net numbers.
Yeah.
Okay, so then my next question, if you're working direct, net, gross, how are they charging you? Because if there's no agency involved, you should be paying net with them.
We're paying for the specific campaigns for each of the organizations. So they outline what they're covering in terms of radio, for instance, radio. So it's radio spots, the number of radio spots on specific stations.
The answer to that is yes. So traditionally, when we go through those contracts, there is so you pay per mount per second on radio, per mount per second, and then the creative is
but
included.
you're buying direct. So typically, these companies sell to an agency that's commission structure. So you should be getting kind of a net price. My other question is more conceptual. There's no digital.
All of these campaigns include digital, including radio. We will have a presence on their digital, on their website, social media. So there is a digital presence as well for all of these entities.
All right, thanks.
In the future, when we're looking at our contracts, so to Suzanne's point, so anything that we purchase, then usually that package will include digital presence on their websites as well.
Okay, thank you.
Yes, Mr. Leitzman.
Okay, thank you. So this takes us through the end of December, so that's 3 months into fiscal year 2025. But it's also a grant, because it's already funded through that. What will we be doing for fiscal year 2025 for the remaining 3 months of that or thereafter? Where are we going to, how do you plan to continue this?
So this is unique because this is COVID hours, and traditionally we have our market plan in which we bring, which shows our funding from our different sources that we already are aware of. It is not unusual for us to get from the department or from, especially with substance use and veterans. Those are the two areas where we will see we have 10,000, we have 15, we have 20. It's very specific to outreach. So in our base foundation plan, it's built into our operational budget.
Okay.
And then what we take into consideration is throughout the year, we are likely to get those various grants. So part of this will continue with our foundation, which is the presentation that you were originally given for the package. And then understanding better, we actually asked Kalana moving forward, how do we avoid this situation? She had a really good suggestion in that because we touch every team, and every team brings funding to us, that when we're building the next model to really look at from a team perspective, do you have expectations that there are large sums of money that might be coming to your team that we should build into this plan?
Okay. So is this additional to what we had already planned to do because of grant funds?
Yeah,
Okay.
this is an additional grant on top of what we planned already into our marketing. The one thing that's really nice about these opportunities is they allow us to fill gaps, because we are mindful in our marketing and our public relation efforts that we are a government entity, and so, and compared to some for-profits, we do build a modest awareness outreach program, and then in those months where maybe we didn't have something planned because it wasn't part of the budget, we use the grants to fill in those gaps.
Okay, thank you.
Is there anyone else? Just wanted to make sure, so this, just to reiterate, this expenditure is 100% funded by the state? Okay, for the remainder of the year? Okay, yeah. I just wanted everyone to understand it wasn't coming from our kind of general fund monies, but it was specifically targeted by the state.
Yeah, and the funds are COVID related, so CSUGs will not continue in the future, so this is a limited grant.
Okay, all right. We've had the request for approval of this evening, and I will leave it up to the pleasure of the board to make a motion for approval.
Move for approval.
Motion?
Support.
Support. Is there any discussion? Time for a roll call vote.
Ms. Woodruff? Ms. Newman? Ms. Root?
Yes.
Mr. Torres?
Yes.
Mr. Landsman?
Yes.
Mr. Young?
Yes.
Dr. Giles? Yes. Pastor Jones?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you.
Thank you.
Thank you very much. Next, we have a couple contracts that were reviewed by the Finance Committee at the Committee of the Whole meeting. And the first one is the MI contract with respect to the repair and upgrade of the dampers in the building. So, Mr. Landsman, do you want to?
I'll make that offer. I'll make that motion, not offer to pay for it. I'll make the motion to support this contract.
We have a motion for approval.
Second.
Supported. Is there any discussion? Roll call vote, please.
Mr. Young?
Yes.
Dr. Giles?
Yes.
Pastor Jones?
Yes.
Ms. Woodruff? Yes. Ms. Newman?
Yes.
Ms. Root?
Yes.
Mr. Torres?
Yes.
Mr. Landsman?
Yes.
Mr. Cowan?
Yes.
Motion carries.
All right. Also, the second contractual item under finance is the American General contract for unarmed security services at the Youth and Family Care Connection. Mr. Landsman?
Yep, I'll make a motion to support this, to cover this contract proposal with AMS or AGS.
Support.
A motion and support. I do have one question. So, is this contract in effect and being extended, or is it not been put into effect yet?
It is for an extended, to expand the hours.
Okay.
So it's an existing contract with an extension.
Okay, good. All right. Any other questions? There being none, we'll have a roll call vote, please.
Mr. Landsman?
Yes.
Mr. Young?
Yes.
Dr. Giles? Yes. Pastor Jones?
Yes.
Ms. Woodruff?
Yes.
Ms. Newman?
Yes.
Ms. Root? Yes. Mr. Torres?
Yes.
Mr. Cowan?
Yes.
Motion carries.
All right. The next item is policy management approval recommendations. We have the previously mentioned appointment for Renee Neto. Yvette, would you like to lead off on this one?
Yes. I make a motion that we approve the appointment of Renee Neto to the RRAC board. Is there support?
A motion? Any discussion? The qualifications look excellent. I can see why you recommended her to be a member of recipient rights team. There being no further, questions or comments, roll call vote, please.
Ms. Woodruff?
Yes.
Ms. Newman? Ms. Root? Mr. Torres?
Yes.
Mr. Landsman?
Yes.
Mr. Young?
Yes.
Dr. Giles?
Yes.
Pastor Jones?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. Our next item is the Quality Assessment Performance Improvement Plan that was reviewed at the COW meeting, and the plan does require board approval. Do we have a motion for approval?
I make a motion that we approve the Quality Assessment Performance Improvement Plan.
Support.
We have unanimous support, almost, yeah. A motion and support. Is there any discussion? A roll call vote, please.
Mr. Landsman?
Yes.
Mr. Young?
Yes.
Dr. Giles? Pastor Jones?
Yes.
Ms. Woodruff?
Yes.
Ms. Newman?
Yes.
Ms. Root? Mr. Torres?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Under that, there is a motion about, or not a motion, but a reference to a board communication template. Does that require any type of approval? Or is that just rolled in?
That was just the program description.
Okay.
Oh, okay.
All right,
Yeah.
thanks. I just saw it on the agenda,
Yeah.
wanted to double check. Okay.
Okay. Oh, okay.
Right. And then, also we have, our needs assessment survey that was also reviewed at the, recent COW meeting, and that also requires board approval.
I make a motion that we approve the needs assessment survey.
Support.
Motion and support. Is there any discussion? At this time, we'll have a roll call vote.
Mr. Landsman?
Yes.
Mr. Young?
Yes.
Dr. Giles? Pastor Jones?
Yes.
Ms. Woodruff?
Yes.
Ms. Newman?
Yes.
Ms. Root? Mr. Torres?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. Next is our consent agenda, board approvals for a variety of minutes, including our own board, the Recipient Rights Advisory Committee, Committee of the Whole minutes, and Citizens Advisory Committee.
So moved.
Motion? And support? Any comment? Roll call vote, please. Yes. No comment on, consent. That's right.
Mr. Landsman?
Yes.
Mr. Young?
Yes.
Dr. Giles? Pastor Jones?
Yes.
Ms. Woodruff?
Yes.
Ms. Newman?
Yes.
Ms. Root? Mr. Torres?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. Just will note for the record that we have a receipt and file on the fiscal year 23 Quality Assessment Performance Improvement Plan, and also our December financial reports. And then that gets us to any other business before the board this evening? That gets us to our board reports. First, Recipient Rights Advisory Committee. I know Dr. Hans is not in attendance. I don't know if there was anyone else who was at the meeting. I don't think so. We'll have
Not to my
wait.
knowledge.
Okay, then we'll have to wait for that report. Next, Citizens Advisory Committee, Christina?
I do not have a report tonight. I was not present at the January meeting, and then for February, our meeting is tomorrow.
Okay,
Thank you.
thank you. And then, SUD Oversight Policy Board, I'm not sure there was a meeting. Sarah is not here, but we'll.
There's one, at the end of this month.
That's right, it's at the end of this month, right, okay, all right. Thank you. At this time, we have the opportunity for public comment a second time. If you have any, is there anyone online who would wishes to speak?
If you are online and wish to speak to public comment, please raise your hand at this time.
Okay, thank you very much. Is there anyone in attendance that wishes to speak? Please limit your comments to 3 minutes. Mr. Cummings?
Fred Cummins, again, President of Alliance for Mentally Ill Logan County. Just want to say, the comments on the CIT and the police interaction, I think was quite heartwarming. I go back maybe 30 years with our daughter, who became abruptly seriously ill at the age of 17. We had quite a bit of experience with her situation in the early years. She had a condition where she would have all of a sudden have a panic attack and would get very agitated and may start running and hurt herself. And we had to get medication that we could give her, and if we gave her quickly, that would come down. Well, sometimes we didn't get it to her quickly. And there were at least several times where we called the police. I don't remember the specific of each one, but one was my wife on the phone with the police, and they said, well, we don't do that. I said, well, you're doing it now. So a police officer shows up and won't come into the house until he gets back up. And I think possibly that time, by the time he got in there, she had calmed down and things were okay. Another time, I believe, they weren't okay, and she ends up they called the ambulance and got her to the hospital. And another time, I remember we didn't get the police to do anything. We knew she had to go to the hospital, and we ended up, we put her coat on her backwards and put her in the back seat so she couldn't go anywhere, and we drove her to the hospital and got her admitted. So it's a traumatic experience for families, and a lot of them don't get any response except that, well, can you come in campground, or, you know, well, we don't do that just yet. Medicaid, no. Well, sorry. So I think there's a lot of people who see a brick wall as opposed to a welcoming assistance. But the police action that we heard about today, that sounds great. And I hope more police departments are doing the same thing. So thank you.
Thank you. Is there anyone else who wishes to address the board? There being no one, we'll close public comment. At this time, we have our director's report by Dana Lazenby.
Good evening, everybody. Dana Lazenby, CEO. I do have a copy of my report, but I did want to take the point to really celebrate the presentation, the Stories That Inspire Hope, with our Director of Training and Justice Initiatives, Tricia, as well as the officers that were here and the co-responder. That is just one of the amazing programs that we have here that we really need to highlight and make sure we're expanding those programs, because it improves access and ensures that people have connection to services. So I really am proud to be a part of this organization where you have such committed people working together here, but also our partnerships and the collaborations that we have are phenomenal. So we have some work to do, of course, like any organization, but it's still good to see the commitment of people in our community to helping others in need. So I wanted to say that. But I also want to talk about the celebration of Black History Month. So we do join the rest of the country in celebrating the accomplishments of Black people or African American people in our community and across the country and across the world. So we also have our DEI initiatives, diversity, equity, and inclusion. And so as a part of that, we have a commitment here in this organization and to the communities and to our provider networks to ensure that we are really cultivating a culturally competent and sensitive service delivery system. So this is not just true for us here within the organization, but out in the community as well, and then also supporting our providers to ensure that they're mirroring those efforts. We also had an annual service delivery feedback survey that was just approved by this board that goes out, and it will be open for public response up until March 29th. So we really encourage you to share that with others, but also make sure that if there are events and things that are going on in the community, we want to make sure that we're there and able to provide that opportunity for people to complete those surveys. What's uniquely different this year, and I think is important, is that we take that survey, but we also look at demographic information. We also look at other ways that we measure what is needed in this community in terms of mental health services and supports. And not just the things that we need to improve or those opportunities to do better, but also how do we expand those programs that are working really well. So that's going to be a critical piece in our needs assessment, our annual needs assessment, that we probably did not focus on as much. We focused on the responses, but we want to make sure that we support it with other data and other information that comes from the county and across the state as well. Our access team, I do have a correction to the report. It indicates that our access team conducted over 3,788 assessments or services in December. That is actually the number for January, so I just wanted to make sure you had that correct number. Also, the celebration, we had our second annual call to solidarity, which we talked about last month, which was a huge success. I think we had more people in attendance than we did last year, and it just really is so important, and it's also mirrors what we're doing in terms of our work, showing that we have to come together and work together to make these programs successful. And I think from the presentation we heard from the law enforcement officers is that they clearly understand, and we understand, we could not do that program without each other and without the commitment of the community to do that service. The other thing I wanted to talk about are school mental health navigators. Since the fiscal year, they have actually served 68 schools and had over 100 referrals. And one of the things that we want to do is really to highlight that program some more, because we know that the need continues to increase. We're listening to the feedback we receive. And, you know, it's interesting, we did receive some feedback that talked about the school mental health navigators that are for any school in this community. And also, we don't highlight the need or the use of those co-pay or deductible dollars that were committed by Oakland County and the County Board of Execs. So we want to make sure we're doing educating the community how to access that funds, because it improves access to outpatient therapy services. So families could either submit their bills or actually submit a copy of their receipt where they paid, and we can pay up to a certain amount because those dollars have been allocated. And it's one of those situations where you use it or lose it. So we definitely want to make sure that families understand that that is available to them. In terms of our crisis line and things of that nature, we continue to work with the state on how we expand our crisis continuum and the crisis stabilization services. And I have to say, when we talk about that, I'll talk a little more about the services that there are some opportunity for us to do more. And we want to make sure that we're identifying gaps and filling in those gaps to crisis services. One of the things of particular interest right now is our mobile teams. And we've had challenges staffing those mobile teams. So we want to make sure we're working with our vendors, our providers of those services, to ensure they have staffing support as well as they have people available to respond to those calls when somebody needs a mobile intervention. So in the future, I would hope that the numbers that I have improve, and I'll be willing to share those numbers. And I'll see Kim over there in the corner, and we'll work together to give you a report on where we are, but where we want to be. We're going to be setting additional goals for our crisis vendors and making sure that they achieve those goals. And if there are barriers to that, what do we do to get them further along? Those crisis services are critical with the co-responders and the CIT. If officers are referring, we have to be there available and ready to respond to that. Let's see, what else? Oh, I also wanted to highlight some of the things that I learned from a national conference. The National Association of County Behavioral Health and Developmental Disability Directors was on February 13th to the 15th. And, you know, it's interesting when you go to national conferences, you want to make sure that you're learning more that you can bring back. So I did highlight a few of the things in my report. The focus, again, is on workforce. I think, like everybody, we know now the workforce is a huge issue in crisis. The legislation in terms of creating solutions, I'll say, to some of the problems we have. We heard about the crisis in the 988 number now is the National Crisis Hotline. But one of the interesting things that I see other states are doing they're now calling it a helpline because they don't want people to think that it's only call for when you're in crisis. It's also calling for just support and to talk to somebody or referral to get the help that the person may need. Or maybe it's just a one-time call and that's it. But they want to make sure that we're educating the community to say it's more than just a crisis line, it's also a helpline. So with that, they had a lot of great ideas of how they continue to fund it to make sure it's sustainable. And in some states, they're actually doing, I don't know, it's similar to a millage where they're asking community citizens to donate 25 cents a month. And that money will go towards building that crisis continuum and crisis response for those communities. So I thought that was interesting. The other thing that they talked about, and I won't go into too much of the other issues, but the other item was redetermination. And when I went to the conference, I thought I would get some ideas of how we can address some of the challenges we know are out there with redetermination. And what I found was that the presentations included a lot of other states who have the same challenges and talked about the issue where you have they're saying that since April 2023, 13 million people have been removed from Medicaid. So that's huge when you talk about the number of people we were serving. And part of the issue also is that with redetermination, they're not talking about people being determined in the right category. So that's the thing that we want to make sure that when we're working with individuals, they are being redetermined in a category that suits their need, but also supported with the funding dollars. So I think the other thing that's really going to, be a huge challenge, quite honestly, is Medicaid spend downs. Some of the information that we're receiving from the state is that while during the public health emergency, Medicaid spend downs had actually ended, right? But the reality is they thought that people were saving money during this time because they didn't have to pay their spend down, and that is very unrealistic when you're talking about somebody who is on Medicaid or have to provide eligibility every month to stay on Medicaid. So that's something that we're going to continue to work with our legislative consultant, Capital Services, and locally to make sure that we advocate for individuals who are on Medicaid spend downs as to make sure that they're in the appropriate benefit plan. With that, I do want to say one thing, and Mr. Torres mentioned this last week, and I didn't have an opportunity to follow up on it, but you talked about the utilization of space in our building, and one of the things I wanted to really highlight and give kudos to our team, especially Ms. Kim Flowers and her clinical team, is that our assessment center where we do our evaluations for ABA or autism services is actually expanding, and we have moved down to this first floor and sort of a little takeover in the area, so we are utilizing that space, and we're making it more welcoming and supportive of those families who are waiting to get those evaluations, which I think is so critical because it's such a sensitive time for a family. When they're coming here, they're scared, they're nervous, they need to have that support. So we're also expanding to other assessments coming very soon, we hope. We'll also be looking for a partnership with a pediatrician so that we can have more of a well-rounded approach on how we support families and their children, and also making sure they're connected to those other resources. We know ideally Troy would not be the right place, so our hope is that we also have an opportunity to help with transportation and supports that families may need to get here as well. So with that, I will turn it back over. One other huge thing, Miss Vicki Suter. I really want her, she's hiding now from us, but Miss Vicki Suter was nominated, and she was awarded from the ARC of Oakland County. She's our Director of Rights and Advocacy, but she was awarded the 2024 Dove Award. She'll be honored next month at the ARC's annual event with the Al Carter, Distinguished Service Award for her endless contribution and leadership in enhancing the quality of life for persons with intellectual and developmental disabilities. So please join me in recognizing Vicki. I think I have to say this, Vicki, since the day I walked in the door, you only need to sit in one room with Vicki and persons that she works with, and they absolutely love her. I see why. She's so patient and supportive, and she just is a true advocate for individuals we serve and their families. So I understand absolutely why she's receiving this award, and, just excited to see our team really making strides and being recognized for the good work that they do. So congratulations, Vicki. That's all I have.
There's a busy report,
Yes.
a lot going on.
Yes.
Thank you for that. Anybody have any questions? Yes, Christina?
Thanks for the report, Dana. You mentioned the 988 line, and I wanted to ask about something. I was looking at the CAC minutes for the January meeting because I couldn't be there. And the Common Ground representative, it looks like in the minutes it says, in September, Common Ground was notified that they are no longer listed on the 988 call line. This is the only chat line that has lost contact. So I just kind of wanted to ask about that.
I would have to follow up on that, because one of the things about Common Ground is they are actually the vendor for 988. So they have the staffing contract to staff 988 at the state level. So that disconnect, I'm not quite sure where that's coming from. The other thing I'll say is I've been trying to get reports so that we know specifically to Oakland County what are some of the calls about and what are the needs. So one of the responses I received was that, it's HIPAA and they don't want to give out personal information about the people who call. But I do think it's important, and I don't want the personal information unless we need to follow up on it, but I do think it's important to understand why people are calling who are from Oakland County. So we can address or even do some outreach to individuals as a community. We don't need to know specifically that Kim called. No, we just need to know what was the concern, that Kim is an Oakland County resident or receiving services in Oakland County. How can we help?
Yeah.
Don't need her name, don't need any real demographic information. We just need to know what some of the concerns are that we're hearing from that are specific to our area.
Yeah.
So I'm still trying to advocate so that we can have that information and respond appropriately.
Okay.
But I'll follow up on that other question you have.
Thank you.
All right.
I'm sorry.
Yeah,
I just wanted to touch base. The workforce issue, that was something that we actually talked about at our meeting last Saturday, our board work session. But we came up with some pretty good ideas of things that was worked in our organizations, and we see it not only in this field but in all of our professions where it's so hard to get workers, and then you're competing, for not just pay but other perks and things like that. So, but we do see that as a huge issue coming up the next few years, and to have somebody here for 45 years, I mean, that's a celebration for sure. And you don't see that because people stay 2, 3, 4, 5 years and move on to the next. So, but it's so important in this field to have experience, to have like the gentleman, the officer that was talking today about, getting in the profession to help people. And I think we all get into these professions to help people, but there tends to be a level of, burnout that starts to happen, of secondary trauma that starts to come into the field and things like that. So these are all things that affect workforce. But we had some really great conversations, which I'm sure Dennis will be sharing with you or has. Thank you.
That'd be great. Thank you. I wanted to recognize, too, that we do internships here, and they're paid internships. So this is one of the ways that we do try to enhance our workforce. And then also, I think, just outreaching people we know who, some people get a degree in psychology and they don't know what to do with it, but we can help sort of foster some of that interest. I think we have to do some things earlier rather than later, and talking about what we do, bring back career days and things like that. I think that would be helpful for young people. But the issue is a now issue too. And so that's really the challenge, is that the demand has increased, but our capacity and ability to respond to all of that is really challenged.
Anyone else? Thank you. Thank you for that report again and responses. At this time is opportunity for board member comments, and, John Paul, we'll start with you and move around.
I think Nancy's still on, so I just want to again congratulate her for her years of service. It's just profound. I think when it was first being told to us that we had an employee that had been here for 45 years, we all as a board were kind of like, wait, what? You know, like, yeah, there should be an award. So kudos to you for your award and for all that you've done. I can't imagine what you've seen in 45 years, and doing the math, it would have been 1978 or 79. I'm 45 years old, and I was born in 1978, so you started right around the time I was born, and that's pretty amazing to think of somebody being somewhere that long, and you know, today's day and age of everything being virtual and things, it's definitely come a long way. You've seen a lot, so, but thank you for your service.
Dr. Giles?
I'd also like to thank Ms. Heffler for her service. 45 years, again, is amazing. But also thank Officer, I'm going to mess up the name, so forgive me, Officer Salamano, Sergeant Watalo, and Ms. Thomas, who came and gave an exceptional presentation. And one of the things that you all heard, as I heard, was the importance of mental health care for everyone, whether you identify as a person served or a person providing services. Mental health care is essential, and we know this time more than ever, a lot of people are experiencing crisis, and it's not limited to a certain socioeconomic status. This crisis, or whatever crisis we experience, definitely affects our mental health. So we all have to pack our patience and be respectful of everyone, no matter who we're dealing with. And then remember ourselves, take care of ourselves and our mental health. I think that's it. Thanks.
Thank you. Good. Kyle?
I wanted to commend us for the retreat. I thought it was an excellent opportunity to get to know each other on a more personal level. We talked about how we came to the board. That was interesting to hear. And I'm looking forward to the next time we come together as just the board. Not that we don't want the staff, but we do need to have more time with just the board. So thank you, all that made that possible. Thank you.
Yes.
Kudos again to you, Ms. Hepler, for 45 years. That's dedication. A lot of folks, like John Paul said, that's how long he's been living, and to do one job and to do it well, we commend you for that. Also, when the CIT officers were presenting, it took me back. I was married to a police officer, and back in the 80s, he considered himself to be on one side of the table and me on the other side of the table. He considered that I was on the sympathetic side of the table, and he was on the law enforcement side of the table. I'm glad to see that we're no longer in silos, and that we are taking community workers out to assist with the de-escalation. Even when Clinton gave money to policing in the 1990s, it really just took officers out on the street. They really didn't get the necessary training. And like Dr. Giles was saying, police officers were kind of looked down on for having mental health issues based on all that secondhand trauma that they were seeing. So it is just a breath of fresh air to see that this program is going to be replicated in other cities and other states across the country. And kudos to OCHN for being on the cutting edge of the service. Thank you.
Jonathan?
Nothing this evening.
Okay. Mr. Young? Christina?
I also want to congratulate Vicki for her recognition. I can't see you because there's a little column in the way. And Nancy as well. Thank you so much for your years of service. Have a good night.
Mr. Jones?
Thank you. I'll use your minutes as well. There's several things. One, and let me begin with congratulations, to the persons who just showed exemplary performance and commitment and dedication to the work here. And I always talk about how great this staff is. So, I really appreciate the extra effort that each one of you put forward and just giving so much of yourselves. So, kudos to you on that. A couple of things on the chairman's report that I just want to highlight. Black History Month in March the 23rd. The Links Organization, Black Organizations, Trinity Health, we will have a health event based on Afro-American diseases, liver, heart, blood pressure, mental illness, opioids, and all of that. Haven Wick, Honors Health, and others will be there, and I'm sure we will be there. I'll get with our staff, but that's going to be on March the 23rd because it's good for us to focus on that area. We'll have some support out of the county on the opioid issue. Secondly, on the solidarity, I can't say enough about Kaylin, who just did an excellent job in pulling that together, and look forward to our meeting this week and what we're going to do next year. So just an excellent job bringing people together to talk about where they were and the commitment that was made, the engagement that was made was just unbelievable. Again, a good sign of the staff and the work that you guys do here. On the 27th, February 22nd, the chair talked about national update and included his criminal justice, and we'll have a meeting with the Chance for Life, flip the shift, whatever that is, whatever, okay? The script, flip the script, I'll get it, all right, tongue twister, flip the script. That's going to be on the 27th, and it'll deal with working with formerly incarcerated persons, returning citizens, and what have you. What a great time that's going to be, because many of them suffer from mental illness as well, stress-related, and so that's going to be on the 27th. And I'm glad that OCHN is just really ahead of the game in all of those areas. And so I say thank you, and it just one more time says what this group does. And I thank you, and I thank God for working with such a great group of people that's around this table. Thank you.
Thank you. Just a couple quick things. Vicki, again, congratulations, and also your excellent introduction of Nancy and her 45 years of service. Just very briefly, we did have board retreat this past Saturday that was compliant with the Open Meetings Act. It was posted and did all the things we needed to do. But more importantly was the substance. And as Mr. Torres pointed out, we had some very extensive discussions on two real critical items. What is the future of what the services that this organization will provide? The landscape is constantly changing, and we need to manage that into the future. The second thing is, as has been referenced by our director and others, is how do we get workers to work with our providers and with us, because we are at a crisis point. And that was discussed at the CMHA meeting, and there was some excellent articles which we distributed for the board retreat. But the one lasting impression I left, and by the way, I will make good on my promise and get a list of all the different ideas. There was no action taken on anything. We didn't do any voting or motions or anything like that. That has to come to a meeting. But the point is we had a lot of ideas, and I think that what it confirmed to me is that we have a talented board with very diverse viewpoints, and that is built into the way we're appointed, because everybody here either represents a provider or a provider family or works in the community mental health system. So you could really see that, at least I could, as we spoke, and also a very thoughtful group. So, I'm very excited with the ideas that we came up with, and, so we'll dump them all on you, no. We didn't burn anything down, so, but we'll share those with the staff and see where we have some opportunities as we move forward and, get those on future agendas, once you have a chance to kind of digest all of it. And I want to thank Sheila for setting everything up for us and being of great assistance. Thank you very much. So with that, we'll, unless there's any other business, we will adjourn.